going. We've got a pretty full schedule, and trying very hard to stay on time. It's my pleasure to introduce David Wilson, who has been a program officer of the project and has provided a tremendous amount of guidance and support. Hey, why don't you go ahead?
Thank you, Lisa. And I'd like to take the opportunity to welcome you. Welcome to the Harvard Centre and to this workshop on benefit cost analysis, this reference case. My name is David Wilson from the Bill and Melinda Gates Foundation, and we are funding this project. We really appreciate that you've taken this time out of your busy schedules. Everybody's busy with many projects, but we appreciate that you've prioritised this project to provide your valuable input. The success of this project can only be realised through people like yourselves coming and investing your time and investing your expertise into guiding where this is progressing. I'm just going to provide you with a brief overview of why we have funded this study. The Bill and Melinda Gates Foundation believes that all lives have equal value. Now, I know that is a very controversial statement amongst this audience. Value means something very specifically here, particularly when we talk about lives. But I don't want to get too caught up about that. But what we prioritise here is that we think that everybody, no matter what their circumstances, where they live, what their income levels are, everyone deserves the chance to live a healthy and productive life. In order to fulfil that goal, we are impatient optimists working to reduce inequity. Because we've got this goal of trying to reduce inequity, we have priorities around the world in health and development. The Gates Foundation it's a family foundation. And therefore, what we focus on are the priorities of this family, particularly Bill and Melinda. This is a bit of a structure of the priority areas, the strategic areas of interest for the Gates Foundation. Look down the centre column. I just want to show you some of the areas that we focus on. Neglected infectious diseases, major infectious diseases like HIV, TB, malaria, diarrheal diseases, pneumonia. Then we consider conditions for the financial services for the poor, gender equity, water, sanitation and hygiene, agriculture, family planning, MNCH, nutrition and polio. They're our priority areas. To support those, we have cross-functional teams in global health and global development and global growth and opportunity. We can see that the blue-coloured areas are those that are more upstream, where we need to develop new technologies, new diagnostics, new drugs, new vaccines. Whereas those on the right-hand side and coloured in grey and brown are more of the downstream areas. We're focusing on delivery. We have complementary areas across the foundation where we have vaccine development, vaccine delivery, integrated development and delivery. Then across the foundation, we have areas of strategy, planning and management, data and analytics. It's in those areas that supports the rest of the foundation areas. And that's where I sit. That's where my team sits. And it's where we focus on data and analytics, anything that's going to support global goods in the delivery of mechanisms against these strategies. But here, in these areas of strategy and data analytics, planning and management for the foundation, that we are very interested in benefit cost analysis. Benefit cost analysis is important to us. Across the foundation, we invest about $5 billion per year. You can see the amount of payout that we've had over the last few years and the areas that we've invested in. But if we consider just the investment that we have in overall, we want to think that decision sciences or using money wisely is extremely important to us. We want to figure out how we can maximize impact. We've got key areas of interest to us. We want to understand how we can maximize impact internally. We're trying to make some trade-offs. Do we invest in vaccine A versus diagnostic B? What do we actually try to develop and design, discover? What do we then try to implement? We have to make some trade-offs. That's why we're coming to you. We want to get some advice from you about what sort of trade-offs should we be making? How do we do those analyses? We've done that with cost-effectiveness analysis in health. We want to broaden from beyond health into other areas of development. We want to be able to trade off our decision-making in the foundation. So we need some guidance from the expert community, from you all, on how to do that. We then want to implement in countries with our partners to implement our strategies to reduce inequity around the world. So we want some guidance for ourselves and our partners in policy design and implementation. benefit cost analysis can help us to do that. We want to set up a framework for external decision makers as a global public good. We want this resource to be available for you all and other practitioners to be able to use this in your analyses. Why is the Gates Foundation particularly taking leadership around investing in benefit cost analysis, particularly in low and middle income countries? It's because we actually care a lot about decision making, using data, using analytics in a way that's going to be most useful. In fact, currently we're spending over $500,000 on data and analytics related to health economics. We invest quite substantially in this area. In fact, this is shown by Tommy Wilkinson just recently. If we look at all of who is funding health economics research in low and middle income countries, this is a breakdown. And we found out that the Bill and Melinda Gates Foundation is actually the highest single donor in this space. It's for that reason that we think that we've got a responsibility to take some leadership and to fund this work in order to establish this reference case. Okay, so why a reference case? We want you to help us to make trade-offs in global development decisions. We already have a reference case. We've got some methodologies for looking at using cost effectiveness analysis to looking at trade-offs in all areas of health. But we're looking at global development as well: water, sanitation, education, agriculture. How do we compare those with areas in health? But we want to expand on our assessments in health and understand the full benefits as well. This is about practical decision making in low and middle income countries. It's about sound decision making. And we want some academic rigor. It's not necessarily about the academic side. It's about making sound decision making that's got a technical basis and there's a bit of some standardization in principles for people who are going to conduct these analyses. A few years ago, we started with developing a cost effectiveness analysis reference case. This is through the International Decision Support Initiative. And now we want to expand that now because cost per DALY is just insufficient. We want to value health strategies to come up with compelling economic arguments. We also want to value non-health outcomes of predominantly health strategies and to value non-health strategies outside of health. We want to look at comparability with health strategies and to guide our decisions within development sectors. So that's it. I want to leave it there. That's why we're funded this work, and we're so thrilled that you're here and really appreciate your guidance. And again, this can only be a success due to you and all of your input. So we appreciate.
Thank you, David. So it's great to see this group. I see some faces who were at our scoping workshop in May at the Gates Foundation, as well as many new faces. And I'm going to take a few seconds to talk through what we're doing, both overall and in terms of today. Talking about the overall goals and objectives for the project, the framework that we're working within, the components of the project, some core members of our project team, and also our plans for today. So this statement sounds pretty good, doesn't it? We're going to increase the comparability of benefit cost analysis, improve their quality, and expand their use. Our focus is on health and development in low and middle income countries, as David said, and we're interested in policies that are implemented both inside and outside of the health sector. One thing that I've realized, though, as we've gone further into it, is that these objectives don't necessarily all fit together very well. There are some places where we have to make trade-offs or compromises or decide what to prioritize. And I'm hoping that the conversation today will help us think through that. For example, if we want people to do more benefit cost analysis, we need to give them clear guidance. We need to make it easy to do. We need to make sure it's feasible, given both resources and data available. And we need to make sure that it's useful both to the analysts and to the decision makers. What do we mean by better? Well, I've read more benefit cost analyses than I can imagine, lost count a long time ago. Many of them are truly excellent, but there are also some that are not so good. So one way of defining better is that we want to take what's being done now and get everybody, or as many people as we can, to be using the best possible practices given our understanding now of what those practices are and data availability and other issues. But we also know there are lots of places where we need innovation. The challenge there is, to what extent do we focus now on getting people up to what are currently accepted best practices? And to what extent do we focus now on innovation, and to what extent does that become sort of the next step later on? Comparable, what do we mean by comparable? Same concepts, same numbers? And how do we deal with the fact that both data and research and our understanding of best practices evolves over time? So what we think might be a good way to do things now and will make things comparable may not be what we think would be the best way to do things in a few years. David already covered this, so I'll try and be quick. The IDSI reference case includes principles, methods, and reporting standards for all types of economic evaluation, includes principles like transparency, being evidence-based, the sorts of things that we hope are the case for any type of economic evaluation. And it also addresses cost-effectiveness analysis. So our primary focus is on monetary values of outcomes, what are usually categorized as benefits, although as you will see, we are addressing some other issues as well. I always talk about the policy analysis toolbox. This is my somewhat lame illustration of a toolbox, but the point I want to make is that everybody in this room probably has some experience doing all these different types of analyses. And I think, as you know, when you're in a particular decision-making process, you may need to do more than one of these. You may want to spend all your time on just a single type. It really depends on the situation that you're in. However, today, this is our focus, benefit cost analysis. We're going to talk a little bit about distributional analysis because it's such an important issue in this context, but primarily we're concerned about benefit cost analysis. David already showed you a version of this slide. The point that I wanted to make here is that the Gates Foundation has a number of priorities that are clearly within the healthcare sector. It also has a number of priorities that are within its development group that may be implemented by healthcare institutions, they may be implemented outside of healthcare institutions. All the way through these different program areas, we do have outcomes that are not health related that require evaluation and benefit cost analysis. The term benefit cost analysis is used in all kinds of different ways. We use it in just lay speech to talk about decision making. But scholars, academics, practitioners also use the terms in different ways. For the time being, we are working within the conventional framework for benefit cost analysis, which relies on a couple very basic assumptions. The first is that individuals are the best judge of their own welfare. So what we hope to do in benefit cost analysis is just to get some information on people's preferences for the benefits that they would receive from the policy, as well as the costs they'd accrue. The other thing is that we don't use money because we're obsessed with money. We use money because it's symbolic. It tells you how you are trading off resources across different things that you could do with those resources. And by resources, I mean labor, raw materials, all those sorts of things. The fact that you are sitting in this room right now means that your labor is being used to pay attention to the session. You're not doing all those other things that you could do that would be productive. So what we're trying to get at here is this idea of opportunity cost. What are we trading off in terms of other things we could be doing or consumption of other goods and services in order to achieve the policy outcomes? So I've been doing benefit cost analysis for, 30, 35 years. People ask me why I do it. The answer is not because I think decisions should be made based only on economic efficiency. Because I have found over and over again that understanding the preferences of people who are affected for the policy is really helpful, both in the decision-making process, but also in thinking about implementation. It helps you understand better whether people are actually likely to do what it is that you hope they will do as a result of the policy. It's also, the fact that it's well established and widely used, particularly in economic analysis, also means that you can pick up a lot of tools, methods, data off the shelf. So you don't have to spend a lot of time figuring out how to do it. And you can spend your time instead poking at what it is about the particular problem that we don't know or should know in order to make good decisions. I think David said this too, it's comprehensive. It allows you to integrate all kinds of outcomes using a comparable method. And I think the last point is probably true of all the different types of analyses that we just talked about. None of them are the sole basis for decision making. Often that's not because of the tool, it's because we don't have the data or the scientific understanding of some of the outcomes we care about. We may not really understand the link between a particular policy and certain types of morbidity or mortality. There's also impacts that are hard to quantify. For example, human dignity. We could think about doing willingness to pay studies to try and understand the value of those impacts, but it's very hard to do, and we need to think about that outside of the analytic framework often. Those of you who've read our materials or sat through some of these other meetings have seen this graphic about 1,000 times. These are some basic components of the benefit cost analysis process. Those of you who do cost effectiveness analysis probably do exactly the same thing. The point is not that these are sequential. What often happens is you get a few steps down, you learn something new, and you have to go all the way back and rethink some of the things that you were thinking about in the initial framing. But the main reason for putting this up is that make the same point that I made earlier, which is the IDSI reference case covers a lot of this. So our main focus is on the evaluation of benefits. Although, as I said earlier, we will be talking some about distribution, and we also be talking some about discounting. So where are we on this project? We're the, I guess the second light blue arrow down, we're at the public workshop. We drafted a scoping report. We also did a stakeholder survey. Both are available on our website. We held a scoping meeting at the Gates Foundation in Seattle, which some of you were able to attend. The slides and the video from that meeting are on our site if you're interested. We then commissioned some methods papers and case studies from a wonderful group, and that's what we'll be talking about today. The reason why that public workshop arrow is not all the way at the bottom of the box, asking you not only to comment today on those papers, but also to submit comments through our website so that we can revise the papers and make sure that they're useful. Eventually, we will be writing step-by-step guidance, and I'll talk a little bit more about that later. Probably the most important thing about this project, though, is the box that's off to the side there. I and several others of you have been involved in many efforts to write guidance, and it's perfectly possible for us to lock ourselves in a room and write up some guidance and send it off to all you guys, I don't know, in a few weeks, few days. But we've learned that doing things that way doesn't necessarily end up with a good product. It also doesn't end up with something that gets used or that's useful. So what we've tried to do throughout this project is do as much as we can to have an open process with lots of public feedback in hopes that what we'll end up with is a much stronger product that you will all find useful. We also know we won't be done at the end of this grant. The grant that we have currently just gets us through this guidance document, but having a document's not enough. There'll have to be more outreach, technical assistance, more primary research on valuation in particular, case studies to help people understand how to implement these methods in different contexts. And there is this whole issue of wanting to go beyond what we can do now and doing some innovative work. The scoping report is available on our website, as I said. It basically covers the framework for the work that we've been doing, and also has a review of some existing guidance documents and completed benefit cost analyses. On the website along with this is a stakeholder survey that we conducted online that includes a lot of very useful comments on what we need to do in order to successfully complete this project. This is where we are now. Like I said, we really hope that you'll give us your comments today and also submit them online. I should say, even if you get a chance to talk today, I hope you'll also write to us because it's helpful to have things in writing. But we also have a very tight schedule today, and I am sure that there will be times when you have something that you'd really like to contribute and we just can't get to you. So please write to us. We are going to be soliciting some additional case studies. We'll be sending information out on that soon. And then be drafting the guidance, which is likely to include some additional topics. For the guidance, we are committed to writing something that analysts can pick up and know, at least in very basic terms, how to conduct the analysis with some illustrations from the case studies. The guidelines will essentially amend the IDSI reference case in order to address benefit cost analysis, and they'll be available online, easy to download and easy to update. We are expecting that the initial draft of the guidance will be focused on what could be considered currently best practices, but we're also going to include some recommendations for what we think needs to be done in order to innovate and improve those practices. There have been an enormous amount of people officially, I guess, involved in this project. We, first of all, are incredibly indebted to the authors and the discussants who are here today, as well as all of you for participating. But we have a core leadership team that includes me, Jim, David DeFranti, and Dean in the back there. We have an advisory group, most of whom are here today, from a number of different organizations. We also have 3 people who are participating in that advisory group in different roles. David Wilson, of course, is our project manager. Tommy Wilkinson, who's been providing the link to the IDSI reference case team. Carl Claxton, who's doing a companion project on discounting, and you'll hear from later today. There have been an enormous number of people from the Center for Health and Science at Harvard who've been helpful at different time, but I'd like to recognize Christina Monk and Lucy O'Keefe, who have been working incredibly hard throughout this project. I guess Lucy's in the back there. Christina's probably hiding out in the registration desk, but they've been enormously helpful. Like I said, we want to hear from you. We apologize for the fact that the schedule today is tight, and hope that you will submit your comments online if time to get to them today. These are just 3 of the types of questions we're interested in. Are the recommendations appropriate, feasible, useful? What can we do to improve them? And what else do we need to be addressing? In terms of our overall schedule, the technical program will run at 5:30 today. Then we will have a reception from 5:30 to 7 just out in the Elements Cafe, which you probably walked by when you came in, with some remarks from Sue Goldie. Tomorrow morning, we have a technical program, but we are really excited to welcome Larry Summers and Dean Jameson, who will be interviewing each other, or maybe Dean's interviewing Larry. I'm not sure quite what they worked out there. This is a way too tiny version of the agenda today. I would encourage you to look at the version in your program. We will be putting up the list of speakers for each session as we move along. We have asked the people who are presenting the papers to keep their presentation within 15 minutes. We'll stop them after 15 minutes. We have asked the people who are acting as discussants to keep their presentation 7 minutes, and we will be stopping them after 7 minutes. We then will allow just a couple of minutes for the paper authors to respond to the discussions, and then we want to spend as much time as possible getting comments from the audience. This again is the schedule for tomorrow, just bigger print because it's a shorter day. So with that, I think I'd like to bring up our first panel. We will be, our first set of speakers will be talking about value mortality risk reductions. Jim's going to present, and Where's Lynn? Lynn's going to